Good day, everyone, and welcome to this lecture. I'm Associate Professor Ivana Pavlinac Dodig from the Department of Neuroscience, University of Split School of Medicine. Today, we will explore the intricate world of sleep disorders, focusing specifically on hypersomnias. I believe you're all familiar with the story about Sleeping Beauty, whose prolonged sleep and difficulties in waking up are experienced by patients suffering from hypersomnia. This complex group of sleep disorders is characterized by excessive daytime sleepiness, an overwhelming urge to sleep during the day, and an inability to maintain wakefulness despite adequate or prolonged nighttime sleep. These patients have persistent feeling of drowsiness or strong urge to sleep during the day, often leading to unattended naps. Nighttime sleep is also prolonged as these patients may sleep more than 10 hours per night but still wake up feeling unrefreshed. Sleep inertia is also frequently present as difficulty waking up and feeling groggy and disorientated upon awakening. Hypersomnias are often accompanied by cognitive impairment, such as problems with concentration, memory, and decision-making, mood changes, and can significantly impair daily functioning and quality of life, productivity, and overall health of affected individuals. Moreover, patients with sleep disorders are at an increased risk of comorbidities such as cardiovascular disease, metabolic disorders, and accidents. Some of the most important types of hypersomnias are narcolepsy, idiopathic hypersomnia, and Klein-Levin syndrome. Narcolepsy is defined as a chronic neurological disorder affecting the brain's ability to regulate sleep-wake cycles and can be divided into two types. Type 1, which involves cataplexy, a sudden loss of muscle tone triggered by strong emotions, and is associated with low levels of hypocretin. Type 2, which does not involve cataplexy and typically has normal hypocretin levels. Besides cataplexy in type 1, narcolepsy symptoms include excessive daytime sleepiness, sleep paralysis or a temporary inability to move or speak while falling asleep or waking, and hypnagogic hallucinations, which are vivid, often frightening visual or auditory sensations. Idiopathic hypersomnia is characterized by excessive sleepiness despite a full night's sleep without any other identifiable causes. Its symptoms typically include prolonged nighttime sleep lasting more than 10 hours, difficulty waking up, and sleep inertia as a prolonged grogginess upon awakening. Klein-Levin syndrome is also known as a Sleeping Beauty syndrome and is a rare disorder involving recurrent episodes of excessive sleep, altered behavior, and cognitive disturbances. Episodes can last days to weeks, with individuals sleeping up to 20 hours a day, along with hyperphagia or excessive eating, hypersexuality, and confusion. Diagnosis of hypersomnias is based upon clinical evaluation, including taking detailed patient history, focusing on sleep patterns, duration, and impact on daily life, and whole-night polysomnography followed by multiple sleep latency test, which measures how quickly a patient falls asleep in a quiet environment during the day. Additional procedures such as actigraphy, in which sleep-wake patterns over several days are tracked by a wrist-worn device, as well as sleep diaries, might be helpful in clinical evaluation. Management depends on the final diagnosis and the severity of the symptoms. Medications such as stimulants, such as modafinil or methylphenidate, are used to reduce excessive daytime sleepiness. Sodium oxybate in cases of narcolepsy has been shown to improve nighttime sleep and reduce cataplexy. Antidepressants are used for managing cataplexy and other symptoms. Behavioral and lifestyle changes include maintaining a regular sleep schedule, avoiding caffeine and heavy meals close to bedtime, implementing good sleep hygiene practices, and having scheduled naps, which can help alleviate excessive daytime sleepiness, especially in narcolepsy. Counseling and psychological support groups can help patients to cope with the emotional and social impacts of hypersomnia. To conclude, hypersomnias are chronic conditions that require comprehensive management to improve patients' quality of life. Early diagnosis and tailored treatment plans, including medication, behavioral changes, and support, are crucial in managing these disorders. Comprehensive research is needed to better understand the underlying mechanisms and develop more effective therapies. Thank you very much for your attention.